Public health in Ohio is your public health department. You tell us what it is that you want, and we have multiple avenues for people to do that. Everything about this belongs to the people.
Welcome to episode 89 of the LorainCounty.com Insights Podcast. I'm your host, Ed Skimmon. Before we get started, I'd like to thank the LorainCounty.com champion sponsors for their continued support. Community Foundation of Lorain County, Lorain County JBS, Lorain County Community College, Lorain County Commissioners, WOBL Radio, and Emerge Inc. Today, we are talking with Mark Adams, Health Commissioner of the Lorain County Public Health Department. Join us as Mark provides an in-depth look at the structures and services of the Lorain County Public Health Department. He discusses the department's various divisions, including community health, environmental health, and emergency preparedness, as well as current health challenges in the county. Mark also shares insights into his personal journey, leadership philosophy, and the importance of community engagement in improving public health outcomes. We've had the privilege of working with the Lorain County Health Department for more than 25 years, which has also led to partnerships with health departments in several other counties. So I'll admit I'm a little biased when I say how essential I believe public health departments are to the well-being of a community. County public health departments protect and improve lives by preventing disease, promoting wellness, and preparing for public health emergencies. They provide critical services like immunization, health education, environmental safety, and emergency response coordination, keeping residents healthy and neighborhoods resilient. Having worked closely with many members of the Lorain County Public Health team, I can say firsthand how seriously they take their responsibility and how deeply committed they are to serving the people of our county. Here is my conversation with Lorain County Health Commissioner Mark Adams.
I'm Mark Adams. I am the Health Commissioner for Lorain County Public Health Department.
Thanks, Commissioner Adams, for joining us and sharing your insights. Could you provide an overview of Lorain County Public Health?
So you have different types of health departments in the state. Some of them are city health departments. Then you have your combined and general health districts. This one is a combined health district, meaning that we provide services for the entire county. So it doesn't matter what city or what village or the townships. And when we talk about services, the department itself provides not just those services that health departments, that's a standard health department type service, but there are many others that we provide, such as our Narcan outreach, that normally not every health department is involved in those type of things, but we are, and we look at, okay, what does the community need? And then we try to find a way to fund it and actually do that program.
Can you describe your role as health commissioner?
Wow. I think my answer is different every time. But when you surround yourself with an excellent group of people, the role of health commissioner becomes more of a, how do I get done what they need to do their jobs? Because that was not what my role was as health commissioner when I was over in Henry County. It was a little bit different because you're a smaller health department. So you're also somebody that's working in the field at the same time. And when I was at a city health department, that was also very different. That was where you're pretty much deployed in the field the whole time. And in this case, it's more where the folks that work here need me to be able to get involved with our legislators more, to get involved with our other elected officials that are local, and also with our state and federal officials, even then go see them. So it was a little bit more travel, but it was establishing relationships on that level that help them when they're applying for a grant or looking at establishing connections in the field to, if they were going to be doing outreach, help them do their job. So this position is more directed in what they need from me rather than what I bring to the table.
In a minute, we'll go through each of the main divisions, but
Sure.
I want to start with what are the overall key programs and services offered by the health department?
It's going to be vaccines. It's going to be the women and children. It's going to be your birth and death records, also your emergency preparedness, your epidemiology, your public health information piece, and then your admin piece is going to be in there. So that's a very general overview, but it's a 360 service to the person and the public.
All right, next I want to walk through the main priorities of each of the different divisions and why they play an important role in protecting the health of Lorain County residents. I thought we'd start with the community health division.
Yeah, community health. So traditionally, that's what you look at as your nursing division. And there are multiple roles, and they have a vaccine division. So that's where they're going to be providing vaccines to people that are going to be traveling abroad. So we have a travel vaccine clinic, which is something that not a lot of health departments have. But then also regular vaccines, back to school vaccines, your flu, your COVID, any type of vaccines like that. And then they have the CMH program. And there are a few nurses down there that work in that program. And I consider that a solely good program. And what I mean by that is it's a pure good. It is a program that works with people that have children with special needs, and they plug them into community resources. And it's a program that's been around for about 70 some years. And of course, when you look at Medicaid and Medicaid cuts and things like that, a lot of people may end up cutting those programs. It's one of those things where that's a program you never want to back down on because there's always going to be that need, and find a way to pay for it because you're connecting those folks to medical care, to medical devices, to specialized services. I tell people in public health, when you walk away from your job after 30 some years, that you can look back at it and go, I made a difference. That is one of the examples that I give people in a public health world. And then we also are involved in suicide prevention. So we have nurses that are working in suicide prevention, also in disease or infectious disease control. And then lastly, in drug or SUD. So we have a Narcan distribution program. We work with all the partners that are out there when it comes to trying to reduce any type of drug-related fatalities or overdoses. And that's one where if you're looking at a program and you want to show, hey, is what I'm doing working? You look at those numbers and you can see it. There's a full department effort, and we've been able to actually reduce the number of overdoses and overdose deaths. And we can directly relate that to the programming that goes on down there.
Can you go through Environmental Health Division?
Environmental health. I'm a little impartial in environmental health because that's where I spent 25 years. And that's your environmental enforcement team. And there's going to be multiple programs in there. So that is going to cover your septic sewage issues, garbage and trash, housing issues. And it's also going to have folks that are geared towards protecting the food environment so that your food is made safely. The United States has one of the best programs when it comes to food safety in the world. And so there are a lot of rules, a lot of challenges to make sure that people are making safe so that you don't walk away and get sick and that you would end up having a death from that. So their job is to prevent that type of thing from happening. Then there are the other side things that happen. It's the sort of the catch-all division. For example, somebody has a tire fire, right? That might fall under the jurisdiction of the EPA, but we're going to go out and take a look at it. We're going to be involved in that. We have St. Joe's, where maybe that's because it's asbestos. That would also be the Ohio EPA. We got involved. So it's one of those, it's a catch-all division. We try to involve ourselves because even though it might be an outside agency, our job is still to protect the residents of Lorain County. So it's not that we don't trust anybody else coming in, but we want to be involved. We want to find out what's going on so we can report back to the public because they're going to ask us, hey, what's going on with this?
My first direct involvement with the health department was pool inspection.
There you go, pools.
Summer job.
I forgot about the pools, tattoo parlors. You don't have a lot of them, but those are ancillary programs. They're important programs. An odd fact, did you know that there's a certain color of paint that you're allowed to paint a pool and it has to be that color of paint? Because if somebody was to be in distress, you would be able to easily see them in the water and know where to go. So it can't be too dark, it can't be too light. But yeah, there's a specific science to that.
Emergency preparedness and epidemiology.
Right. Now, that's also another one that not every health department has. Sometimes it's regional. It just really depends. This is a large department. So we have both a large epi team. And when I say large, 3 people on an epi team is large. There are some health departments that share one epidemiologist with 6 health departments. But there's a lot going on in this community. And for me, look at that, and I talk about it often, as that dream team that's put together. You got the one that can really write out what's happening, one that does all the data mining and finding it, and the other one that loves putting in graphs. And the 3 of them work extremely well together and are able to tell an excellent story regardless of the disease or situation. The reason that they're with the emergency preparedness piece is because usually when you're activating your epi team, it's because something is happening, whether it's foodborne, whether it's a outbreak of some case. So that's where you have your emergency preparedness folks, and their job is really meeting and tying in the emergency response teams that are in the community with public health, plugging us into those things so that we all respond together when situations happen.
How about the population health division?
Pop Health. I call them my thinking group. They think way higher than I do. They're the dreamers on how I'm going to prevent something. They come up with a dream on what activity or what education piece should exist to be able to try to change or make the opportunity to live a healthier life. So when it comes to a walking path, you don't just lay a walking path down. This is the team that says, this is the best place to put a walking path. And so the cities then ask them, where's the best place? Or in the metro parks, where should this go? Is this a good place? If I'm going to do cancer screening, where's the best place to do that? And so this is a group that then works with the epi teams and comes up with the data, says this is probably where the best place to do that. So they're my high-level thinkers, I call them.
How about the WIC division?
Another one of those, when you're talking perfect good, here's a team of people that are dedicated to making sure expecting families and babies once they're born have the ability and opportunity to thrive with the best, with availability to good food, plugging them into community resources. That is another one where when you're at the end of a career and you follow those families around for a while and you get to know them, while it may be a job, you could see the emotion that is tied, especially when those families are in and they're telling their story about what's happening. There's a lot of times when I've seen somebody from WIC retire, they're so sad that they're retiring. It's one of those things, but they feel like maybe there was another family they could help. That's what they do.
How about internal IT, like their administration, internal divisions?
That's our admin. It's I guess, the jack of all trades piece. It's the glue that really binds everybody together. That's our finance team. That is the clerks that we have, the ones that are down. So that's the first face that you see when you walk in the building downstairs. So we're always going to have a face there, and people are going to come in and see and be representative of the department and of the community. And so that also covers our vital stats division and also provides the administrative support for community health and for environmental health. We have some that have very specific talents and some that are here as more of a generalist, and they like the ability to be able to move through departments and learn how each of them run. And so maybe they want to work at the front desk, but also in vital stats or also in community health. Our mission is to serve and support a healthy community. And they are the supporting piece that without the supporting piece, well, it would be almost impossible for those working in the field to be able to do their job.
I know health education is an important part of the organization. Oh, yeah. Can you talk about the different ways in which you engage the community and what messages you try to promote?
Even though a lot of the people that are in population health are school-trained health educators, and even their position might have education in it, it's really everybody in the department is, and at some point, not really required, but encouraged. We want them out of the office. Admin folks, doesn't matter what position you're in, but we try to participate in just about everything. I used to get mad. I was in the military. I was in the Coast Guard, and I would get mad at the Coast Guard all the time because I'd always say, why don't you advertise? Why don't you let people know what it is that you do? I remember one time, this is 20 some years ago, somebody told me that if they're the right person, they'll be able to find us. And for me, everybody in the community is the right person. I want them to be able to find us, and I don't want them to have to guess where we're at. One of the things has been a real big push in the last couple of years of doing just about every community event that we can. Let people know that we're their health department. We serve them. Doesn't matter what somebody makes financially. Doesn't matter. Their financial status doesn't matter. Where they live doesn't matter. We serve everyone. I want to make sure that everybody knows that. So we've been really participating in job fairs, lots of speeches. So we go and we talk to a lot of the universities and colleges, the high schools, the grade schools, a lot more involved in the last couple of years with getting the word out on what public health does, because it's not really just a career, it's a way to change lives. And so we want to make sure people know that, hey, if you need something, we're here. But also, if you want to choose it as a career, come on down.
On this podcast, we've talked with a number of different organizations that provide health-related services. Could you talk about the importance of Lorain County's health delivery ecosystem and the ways in which you work with partners?
This is something that I found that is unique. I feel that it's unique. I know somebody was listening to this outside of Lorain County. They say, oh, Mark doesn't know what he's talking about. But having been in 3 different counties, I will say that the unique situation that I feel Lorain County, that we are the perfect size, that we're not too big, we're not too small, and we have tons of community partners that are out there. So not just the hospitals, but also those community organizations that are working on infant mortality, that are working on getting food out to people in food deserts, that work on getting shelter to people. So the nice part about it is that we can all meet in a room. We did a kids summit on Monday. And when you see 300 people in the room and almost everybody's from Lorain County, that's when you get a feeling that they always show. That didn't always happen everywhere I was at. All these community partners always show. And they're not showing just because we're going to take a picture and put it on social media. It's because they care. So whenever there's a CHA event, when we're talking about the community health assessment or community health improvement plan, there's 300 people in there. It's just everybody shows. They look at health as being the important piece. So it's a symbiotic relationship. We all talk to each other. We talk to each other often. And we're almost always the same people in the meetings. That's what I think is cool. Now, I've never experienced that in my career in 34 years, where you walk in and you're looking at the same people. People stay in their positions a long period of time, which helps build that. You're not always having to play catch up because somebody's took the job and then they left, they took the job and they're getting retrained. It's they stay in because they look at this, they put a foothold and they say, I'm going to stay here. I'm going to put my feet in cement and I'm going to make sure that we make some change here.
We're seeing rapid technology change. In what ways is technology changing how the public health department delivers services, tracks data, and communicates with residents?
Not much different. So probably the most innovative thing that we did was online scheduling. That was pretty much the change in the last 5 years. That's what the community needed though. So the community wasn't looking at us saying, hey, we need you to do telehealth. In fact, it was quite the opposite. When we looked at doing clinics and stuff like that, we didn't see our numbers dwindle. They wanted to see us in those various places. So that didn't change much. But when it comes to data collection, huge. So we did get a server that was dedicated to ArcGIS. We wanted to be able to produce the best data maps that are out there and to be able to tell the story to any community partner that wanted it on where's cancer going, how is it moving through a community, or any other type of disease, or something else that might be happening. How do we best deliver Narcan in the community? And we looked and we mapped out where overdoses are, and we went door to door and we talked to people. We do that once a year, and we can prove that actually made a difference. But that's how technology changed on, wouldn't say maybe the delivery, but on the background on how we do our job.
What current health trends are you watching closely, and how might these developments affect the way the department works?
30 years ago, I would call it all quiet on the Western Front. There was so little going on. It was very weird. And then it started maybe in 98 with West Nile virus, and here comes something new, novel. And then it was a meningococcal outbreak in 2003. Then in 2009, H1N1. And again, 2020, I usually don't repeat what happened in 2020, the thing that caused chaos. But it's a constant monitoring that goes on. So constant communication with the data that's produced with our community providers. And so we are constantly mapping out, do we have a headache anomaly? Do we have a stomachache anomaly? With our emergency preparedness team, they're in constant communication with neighboring communities. What's happening over there? When I first started on public health, we were concerned about what's happening in our little pocket. Now, the difference is what's happening regionally or statewide. Because then we now look at it as we started talking in terms, before we even had an Mpox case, let's say, the most recent thing, or even measles. When I would get called from a news source, they would say, have you had a case yet? My answer changed from 30 years ago. It would have been, we don't. My answer now is, and will always be, it's here. We just haven't found it. But let's just assume that it's here. There's no reason to pretend that it's not and wait for that case to come through, because that's data that's too late. Let's react that we have it, and let's move forward with what we're going to be doing with our education, just assuming that it's here.
How about current health policy changes? How are these impacting or potentially impacting the Lorain County Health Department and the health of residents?
Not too much has affected us other than the chaos that's in the background. The firing, the hiring, the rehiring, all of that was unnecessary. The chaos that gets created, and I know of a university that has a degree in chaos management. And I worked for a mayor one time that created this chaos, because what it does is a hard reset. I'm aware of this. I know what that looks like. But the general population, they don't really see that. They don't know. And you see those mass firings, but then you see everybody coming back. What did that do? What did that accomplish? Create a chaos and maybe a hard reset. But at the same time, did it save money? I don't know if that's really what it was intended to do. I think it was intended to sort of do that hard reset. Do you want to do that to your public health entities? So now you've got this fervor that goes on about it's now anti-public health. When did that happen? This is a department that solely comes in that only wants to provide services for you, and you could choose to take them or not. How did it become an evil entity? And amazingly, how many people have, especially during COVID, that called and left messages and death threats. We did not do masking mandates. The health department cannot do that. There are things that we cannot do. And what happened was, I can't call Washington and be angry, or I can't call Columbus and be angry. So I'm going to go find the one person that'll answer the phone, and I'm going to say these things to them. One of the things that recently has happened, we realize that people are angrier now. So when we go out and do like our housing program, I send them out in twos. I never had to do that in my entire career, but I send them out in twos now because I'm afraid that somebody might attack them, that they're just simply going out to investigate somebody open dumping drums or something, and that somebody just randomly attacking them. And somebody could say, Mark, why would you worry about that? I don't think that would happen. And we literally just had a random attack on the police officers. So you can't assure me that they're completely safe. So that is what has changed, is that this chaos has created fear. And I know some people want that, but I don't think that's really where our community should be.
From your perspective, what are the biggest health challenges in Lorain County right now?
Battling misinformation. That is the only challenge, where people would rather go to YouTube and TikTok and figure out that maybe if they drink gasoline, it will cure a disease. And that literally happened during COVID. Somebody posted on Facebook that this will cure it, or something else. Instead of just making a phone call and talking to somebody that is non-judgmental and say, just ask us a question. Or instead of calling your primary care provider, They're choosing to look at somebody that is simply doing something stupid for likes. They're making money off of it. And for some reason, people aren't seeing the forest through the trees. And we don't make money off it. You could have 1 million people walk through this building. I don't make any more money off of it. That's how this works. This is your health department. Public health in Ohio is your public health department. You tell us what it is that you want. And we have multiple avenues for people to do that. It's literally your building. Everything about this belongs to the people. And you have a direct relationship with it. You don't need to go to YouTube to somebody that you're not going to have any direct relationship with, somebody that's trying to sell you something that's telling you something that benefits them because they're doing it for money and likes. That is why they're doing it. It's not because they really want to help you.
What do you see as the biggest opportunity for improving community health in Lorain County?
The biggest one would be getting out there more. This is what happens when you aren't in the community very often. So if you haven't built up a level of trust with your community, when the S hits the fan, how would you even expect the community then to trust you if you haven't built that up first? Now you've got a whole battle. So when it came to vaccinations, you got this whole battle of trying to convince people, hey, it's safe. Hey, if you want to take it, you can take it. I'm here to give it to you. I watched people pass out in line. They were so nervous. They had gotten so scared and it built up in them that it was very difficult for even me to calm them down because I hadn't established a relationship with them. And I say that not only just with me, but just in representing public health is that we got too used to being in our offices instead of our job, which is half of our title, public health. We have to be out in the public. The public has to see us, and it's hard for me just to say we're your health department if we're not out in the public showing you we're your health department.
How do you measure success at the health department? What are the metrics that matter most to you and your team?
Always trying to reduce disease. That is one of the successes. And another success would be how fast do we let partners know that something is happening? Do we have an anomaly? There's no particular, for example, I go back to that Narcan one. When you're looking at the number of overdoses going up year after year over a 10-year period, you don't put a number on, okay, we're going to do this activity. So we're going to go door to door and we're going to pass out and talk about Narcan. We never put a number on what success is. We knew we had to try something different because what we were doing was not working. So our success was putting together, going door to door and talking with people safely. That was a success to us. We were hoping that the Narcan would get into the hands of individuals and prevent an overdose. We would hope those things, but we wanted to establish relationships. And boy, did we. So we saw our bystander saves jump, and we saw first responders having to use their Narcan go way down because they weren't having to call 911 anymore to come out because somebody was there that with a Narcan kit that we gave them or that they got somewhere else and was able to save that life. Yeah. So that turned out to be a success, but we didn't know that because that wasn't what we were looking for. But it's always in the back of our mind, how can we reduce disease or infection or reduce mortality in some way? And right now we're racking our brain trying to reduce infant mortality. The state of Ohio is I call it an emergency, whether we want to call it that or not. But when you have the number of children not able to get to 1 year old that we have in Ohio, we're a first world country. We are a top state. We need to change that. And Lorain County is just as affected. We have way too many babies dying.
Let's switch over and talk about you. Tell us a bit about your background and what led you into public health and eventually here to Lorain County as health commissioner.
What led me into public health? I got to tell a real story. It's a true story. I'm an Army veteran, and I got out, I went to college, and I could not find a job. It was the early 90s, and I said to my wife, girlfriend at the time, I said, I'm going to go back into the military if I can't find a job. So I had called Jobs and Family Services, and I talked to a wonderful lady named Karen Wolfangle, and I told her the story. I said, I'm a veteran. I can't find a job. What do you got? And she's like, come on in. And this was what they called back then the welfare department, but now it's Jobs and Family Services. And so they made me an income maintenance worker where I evaluated someone to determine what services were provided for them. And I hadn't made a connection with public health yet. But what had happened was 9 months prior to that, I had put in an application for the Canton Health Department. Well, it took 9 months, but they called me. They said, we'd like to have you come in for an interview. And I went down for the interview. I was late. I was disheveled. I looked terrible. I think I had the same double-breasted suit that was 5 years out of style. And I go in for my interview. I ended up getting the job. The health commissioner at the time reminded me that I didn't get the job because I was a better applicant than anybody else. He said, and he always wanted to remind me of where I was at, level of importance. He said, I hired you because you were the only one willing to take $24,000 a year. And I said, okay. So I know where I'm at with you. All right. And there was a situation that had happened while I was doing this job where there was a very poor community, mostly really a Black and brown community. And there was a big plant that was next to that community. This plant was polluting every single day on this community. This plant was owned by the brother of a very high-ranking government official in Ohio. And so I go out and take my samples, and clearly it's coming from this stack and it's polluting all over this community. So I go back to my supervision and I say, hey, we got a problem. We got to enforce this. And I was told I don't have enough evidence. And what do you mean I don't have enough? All right. So then I go out and I take tape samples. I go back into the lab and I look at under a microscope. This is clearly same material coming from there. So then I go back to my supervisor and I say, hey, we really need to do something about this. And I was told that there's not really enough evidence. This is bull. I'm going out every day. I'm talking with these residents and they're telling me what's going on. Nobody cares. And I'm starting to look at them going, I believe you. I don't think actually anybody does. Yeah. So I mentioned the veteran thing because I did something that I don't think I'd get away with today. I went over to the National Guard and I was in an air attack unit and I was talking with a couple of people and I say, hey, can we take a helicopter and go fly over this plant? There was a pilot. He said, yeah, let's go fly. So it's the first time I was flying and taking photos of this plant. So I was able to get good aerial photos that showed this stack and that showed clearly this plume was coming out from the stack and covering this neighborhood. And so I didn't go back to the office at the time. And I tell staff that when you're in public health, that it's a 90% job, 10% advocate. That there is a job and that's the part you're going to love doing. But when you're going to really love doing it is when you're advocating for the health of the people in the community and you're making a difference. Because if it just is a job every day, that's how you'll treat it. I clocked in, I clock out. That's not what public health is. There has to be advocacy in it. So I did not go back to my supervision. I did something that I hope none of my employees ever do because I remember that story. So I always make sure that I'm always open to what it is that they're telling me. I went to elected officials and to the media and I said, this is what's happening. And I don't think we're doing anything about it. And I was expecting to get fired. In fact, they're probably talking about it. So let's get rid of this guy. It was the first time that the health department had gotten bad press in 50 years. The last time that they had gotten bad press was when they tore down William McKinley's home in Canton, Ohio, because it had become dilapidated. I think that was in 1954. So 50 years had gone by, or 40 years had gone by. And I remember at the time, my mentor looked at me. He was really mad at me. And he said, did you learn anything? And I said, yeah, I learned that we have never been doing our job more than we are right now. That is the first time I realized that I'm doing public health because they didn't really have public health degrees per se, unless you got a master's in it, because I went to pharmacy school and that was my major. But that was the first time that I realized that I had been an advocate, because in the Army it was a job. You didn't realize you were doing something in the National Guard and stuff like that. You didn't realize what it was that you were doing. But that's the first time I realized that it wasn't just a job, that I was doing something that was going to change something. I've tried to do my career. We've done some innovative things when I was down there. We created pretty sure that it was the only health department run recycling center in the United States. And it's still in action. I've been gone almost 10 years and it's still open. But also this cleanup program where you go through neighborhoods and you work with your judges and bring in community service workers to do neighborhood cleanups. We brought that program here as well. And so we go through communities and not only do we write up the problem that exists, the public health issue, but then we fix it. And instead of just letting it sit there, the objective is trying to clean up neighborhoods. The other thing would be is having this EPI team. And I wanted to have an EPI team that feel it's one of a kind. I'm very proud of it. They do an excellent job. The population health, every single one of the teams here, they all do something that's a little bit different than from where I came from. And so encourage as much thinking outside of the box as possible. So my job, like I said in the beginning, is what can I do to make you more successful?
Since you've been with the Lorain County Public Health Department, what are you most proud of accomplishing?
The last time an internal candidate was hired in the department to lead the department was nearly 45 years ago. We did a real big education push over the last 3.5 years because I'm going to retire. That's going to happen soon. And we now have well over 25 people that any day of the week, they're extremely good leaders, capable, strong, young minds. And they're going to be able to take the department in a place that I could not go because I'm up there. They're going to be able to really change the way that public health is delivered in the community. So when you said accomplishment, I don't look at that one as mine. I look at it, though, as an idea that I help facilitate. Made sure I let people know from the very beginning, what can I do to make you better? What do you want to do? And then making that happen.
How would you describe your leadership skill? What approach do you take and who's influenced that the most?
Mine is the reluctant leader. So I've been in a leadership position, especially even since the military, for 35 years. I've never fought for that position. It's not been something where I said, I'm going to take your job. I'm going to go do this. When I went and got my master's degree, it wasn't because now I get to be the director. And when I went to primary leadership development school in the military, it wasn't so that I could be a sergeant and automatically assume I'm going to be a sergeant in control or command. But the best example I can give you is I took a break so I could get my master's degree out of the reserves, and I went and got my master's degree. Then September 11th happened. I had no intention prior to September 11th going back into the service, but I went back and enlisted. This time I went into the Coast Guard. My objective was, what can I do to help the country out to make sure that we capture or do whatever we need to do to make sure this never happens again. That was the sole reason I wanted to go back in. I didn't go back in to be in command, nothing. I was a Marine Science Technician second class that is in charge of nothing except some testing equipment. But it was a great job. It was being in the field again. There was an officer that stopped me and said, listen, I've already started this for you, but we're sending you to officer candidate school. And I thought, okay, whatever you tell me to. And the Army would say, whatever you tell me to, drill sergeant. But I said, okay. And so then I went, and then I was an officer. And then the first thing they did was put me in charge in my first duty station on active duty in Buffalo, New York. I'll do it. I'll give 100%, but I don't seek out those things. My leadership style is, again, the one that doesn't seek that out. But at the same time, the most important thing to me is the people. I don't want anybody hurt. So the people that work for me, that work here at the department, the constant worry that I have to make sure they're safe, to make sure that they have what they need to thrive, it causes a great deal of stress. But that's what comes with a reluctant leader, that there are multiple different leader types. Sometimes you need a forceful leader. Sometimes you need a passive leader. And this department needed anything. It's just that what they got was me. That's probably my leadership style.
Outside of work, what are your hobbies and interests, and how do they help recharge you?
I fish and I hunt. When I tell people that, they always look surprised. You're an outdoorsman? Yes, I am. And because I'm with someone, you're not thinking about work at that time. I also, the one where sometimes you need something technical to take you away, I fix jukeboxes and pinball machines. I don't really tell anybody because then they call you and say, hey, the machine's not working. But I have machines going back to the 40s all the way up to current internet type machines. But I'm told very often by my wife, why do you have 30 jukeboxes? I keep them hidden in a back pole garage. And every so often I give one away. I put money into it, but the win is when I get it working and it's playing music. And unfortunately, I have a ring cam that catches me if maybe I might dance when I'm in that back pole barn. But I do celebrate my wins if I get something working that's 70 years old. The old scratchy sounds that come across an old album, the sound means the world to me.
Finally, where can people go to get more information about Lorain County Public Health and connect with you?
Anytime they can write me at madams@loraincountyhealth.com. I always tell people it's a very unfortunate email to have, madams. But ever since email came out, that has been my email handle forever. Or they can call 440-322-6367. That's our main department number. And if you want to talk with me, then you just say, I want to talk with Mark. And it goes to my cell phone. So they'll transfer it right to my cell phone. And then our website, loraincountyhealth.com. Everything is on there. And there's a search bar to be able to search for what it is that you need. And I'll tell you the importance of that search bar. If you're looking at it saying, oh, I'd rather just have a breakdown list of what it is, the nice thing about that search bar is it tells us what people are trying to find. So then what we can do is make that more visible. So we look at those metrics. It's very important to us that we look at the metrics, and we do that every month. So that way we know what to highlight to make it easier for the next person to find if they go looking for it. So those are the three ways of connecting with us.
Thanks, Mark, for joining us and sharing your insights.
You're very welcome.
Thank you for listening to the LorainCounty.com Insights Podcast. Each episode, we share conversations with the people shaping life in Lorain County, from business and government to education, nonprofits, healthcare, and entertainment. Be sure to follow or subscribe on your favorite podcast platform so you never miss an episode. You can also visit LorainCounty.com to discover local events, volunteer opportunities, and more community resources. If you know someone who's making a difference in Lorain County, send us a note at podcast@loraincounty.com. We would love to share their story and insights. Special thanks to our producer, Leah Gerke, and to you for listening. This has been the LorainCounty.com Insights Podcast, conversations with the people shaping Lorain County.